The medical forensic examination will address the healthcare needs of the patient, beginning with a comprehensive head-to-toe physical examination once informed consent and medical stability has been established. Documentation and trace evidence is collected based on statements provided by the patient and physical assessment by the examiner. Visual inspection of all body surfaces, identification of injury, and genital examination is completed and documented on the State of Utah Sexual Assault Form. Photos are taken of injury and are available to law enforcement per patient consent and agency policy. DNA evidence and injuries are short-lived and may not be present if the exam is delayed by several days. Currently, examinations are conducted up to 120 hours or 5 days post-assault. It is encouraged to request an examination even if the patient reports having bathed or showered. Exceptions to the time frame are considered depending upon extent of injury and the reported details of the assault. It is recommended law enforcement officers consult with a SANE or FNE nurse if they are unsure if a forensic exam should be completed. After completion of the physical exam, medications are offered to the patient for sexual transmitted disease prevention and emergency contraception. These prophylactic medications are most effective if given to the patient within 72 hours. Resources and follow-up care instructions are also provided. Upon completion of the medical forensic examination, law enforcement will be alerted to collect the sealed State of Utah Sexual Assault Evidence Collection Kit. Contained within the kit will be evidentiary swabs from the patient's body. Additional evidence may include urine, blood, which require refrigeration, hygiene products, and clothing. These items may be packaged separately outside of the sexual assault collection kit. Upon prompt collection, the sexual assault collection kit, the officer will be requested to sign and date the chain of custody form provided by the forensic nurse, showing what evidence was gathered. If a patient has agreed to be interviewed by law enforcement, the medical information and details of the exam may be disclosed to law enforcement. A copy of the examination paperwork will be made available to both law enforcement and the Utah Bureau of Forensic Sciences. If the paperwork is attached to the sexual assault kit, it is necessary for evidence analysis and should not be removed. The State of Utah Sexual Assault Evidence Collection Kit is then booked into evidence per each individual agency's policy and procedures.